the thing is, can we just like start over? Like just introduce yourself so that when we edit the video, we can move you to the
Sorry,
front.
I was nervous in the beginning and I was like, but okay, yes, we can totally start over.
Okay.
Hi, this is Melissa and Bevan from CBD Reviews, and we're here with Dr. Jasmine Shanelle from Instagram. She is a veterinarian, and she's also a cannabis advocate, and she's here today to share about her story and her background and what it takes to be a veterinarian and her experience with CBD and cannabis. Thank you so much for joining us today.
Hi, thank you for having me. I'm honored to be here.
How's it going?
Good, how are you?
Good. I love your hair. You look so pretty.
Thank you.
Yeah, so this is our second interview that we've done over the this website platform. And I think it can only record for 20 minutes, right, Bevan?
We'll record for as long as you want.
Okay, cool. So we don't have a time limit. Awesome. So yeah, I sent you the questions, and I was just gonna start with the first one, if that was okay with you.
Sure. Can you see me okay?
Yeah.
Okay, cool.
Yeah. How does it look on your end, Bevan?
Looks good.
Okay, cool. Everyone can see each other. Awesome. All right. So my first question was, what makes up the process in order to become a veterinarian?
So the process to become a veterinarian, it takes about 8 years. You have to do 4 years of undergraduate. Most people major in pre-veterinary science. I majored in animal, poultry, and veterinary sciences just to cover the whole spectrum, but pretty much any degree in the sciences, so biology, chemistry. And then after you get your undergraduate bachelor's degree, it's another 4-year process through the veterinary medicine program, and then you get your doctorate. If you want to, once you get your doctorate, you can practice general practice, and you can pretty much practice on any species you feel comfortable with, but most people go and find like a mentor or more experienced veterinarian to practice with. And if you're interested in specialty medicine, you can go into a particular field. So I did a laboratory animal medicine research residency because I really like that.
Oh, wow. That's cool. Wow, it's a huge process.
Yeah, it's the same process for medical doctors. So we're in school the same length of time.
Oh, wow. What would you say is like the most difficult part in your entire like career getting up to this point in your life?
I would say the most difficult portion, the curriculum is really, really tough. But in terms of everything, it's having that support and keeping the momentum, because when you start off, you're really excited, you're extremely motivated, and then you start getting into the process and you get weighted down by real life issues. And so having people who are there to like inspire you and keep you uplifted, like that's really what you need.
Oh, wow. Awesome. So what exactly was it that drove you to become a veterinarian?
For me, I knew at birth. Please forgive my cat, Soleil. Hey, Soleil.
That's okay. So cute.
I'd say I knew since birth. So my parents put me on a horse at 11 months old at the fair, and I refused to get off. And so they just kept exposing me to animals as I got older. And my focus, like since I was a child, was always, I want to be a vet. And then as I got older, it just expanded into which particular species I want to work with, which was all of them. So I think that's why I went into general practice and exotics, because I didn't want to be weighted down. I wanted to do everything. And, as I got older, I tell people exposure and education are the key to pretty much doing anything that you put your mind to. And my parents made sure that I was in a lot of after-school programs with animals, any opportunity I could to volunteer at animal shelters, at barns. And then as I got older in high school, they made sure I was in summer camps. So I would go to the veterinary school summer programs out of state, just so I could get exposure to what it's like to actually be in vet school and talk to students who were there. And then once I got in undergrad, I really focused on honing my skills in science. So I didn't just do veterinary programs. I would do programs with the Centers for Disease Control, just anything that you can to make yourself unique and set yourself apart.
Wow. So you've been training for this your entire life.
I think so, yeah.
That is awesome. That's really cool that you found your calling so early in life. Not a lot of people can say that.
No, I feel very blessed, and now I'm like on to the next frontier.
Oh, that's exciting.
Yeah.
How long have you been professionally working with animals?
Professionally, I graduated in 2015, so about 3 years now.
Oh, wow. That's so cool. 3 is a good number.
Yeah.
Yeah. When was it that you first got involved with cannabis?
I first got involved with cannabis when I moved to Portland. So I originally grew up in the Southeast in Georgia, went to school at Tuskegee University in Alabama, and cannabis was illegal. I moved here, and at that time it became recreationally legal. And as I was practicing medicine, I had a lot of clients coming up to me and asking me about cannabis for their pets. And I'm like, I have no idea about it. And so at that time, it kind of triggered like, this is the frontier of where we could be headed. We're already out west. And I started delving into it, the uses that it has had for humans just for centuries. And then when I found out it had been used for animals in the past as well, I was in. And it's a wonderful plant. So I don't think anyone can argue that.
Yeah, right. It just makes life so much better. How much would you so you started using cannabis recreationally before you came into knowledge of CBD, correct?
Yes, I had tried it before actually learning about the benefits of CBD.
Okay. And then when did you start getting into working with CBD?
I got into CBD, I would say around 2016 more so. So 2015, I learned about it recreationally. And then 2016, I really learned about the benefits medicinally. And that was because I was working in a hospital situation and I could see the research and how it was benefiting the children and benefiting people who had seizures and cancer. And then I was working in a lab animal setting with the same animals that had the same ailments that humans had. And I saw that the cannabis had worked for them as well. I just noted that the research was way, way, way less pushed than other areas. And, that's just due to, the history of it and the negative propaganda that it's gotten over the years.
Mm. And do you recommend like your patients to use CBD in your practice as a vet?
Yes, I do. I think it should be used as a holistic approach in conjunction with other therapies. I don't believe that CBD is the cure-all for everything. I feel like it should be used with other therapies that you're currently undergoing. But for patients that I have, a large geriatric portion of my population, it's just because people are practicing better medicine, animals are getting better care, and they're living longer. And so they're getting ailments that humans would get. Cancer, degenerative joint disease, they're getting arthritis. And those are things that we know, seizures, that have been used with humans in CBD. And so I used it with my patients. And it worked really well, especially for those patients that are really anxious. And so either they just have separation anxiety. I have patients that have been previously abused and they're just very sensitive. And then I have patients that it's 4th of July and the fireworks are coming. Mm-hmm. And, they want to give them something, but they don't want to kind of alter their personality and alter their state. And so that's when I generally recommend CBD.
Oh, that's totally understandable. Yeah, I give CBD to my cats. One of my cats has pretty bad anxiety, especially when other people come over. She hides. But I notice when I give her CBD, she's a lot more friendly and she'll come out and let people pet her. And normally she's like very skittish and doesn't want anybody touching her or getting near her.
It really, you can see a difference. And at first I didn't believe it. I'm like, okay, everyone says that. And then I used it with my cat and she loved it. And then I used it with my dog who has anxiety issues. She's a German Rottweiler, and she has really bad hips, especially in the wintertime. And I could just see she's jumping, running, playing. And I'm like, who is this dog?
It makes me so happy that animals can get the same exact relief that we are able to get from cannabis. It's amazing.
It is. I mean, in the morning, I'll get up and I'm like, okay, I get my CBD, you get your CBD. It's gonna.
Well, how much CBD would you recommend for pets to take?
So it depends on the specific case, but it's a really high safety. And in terms of most patients, the range can be anywhere between, I've seen 0.5 milligrams per kg, all the way up to higher doses, such as 2 or 3 milligrams per kg. And really, I just say speak with your veterinarian or a professional who's knowledgeable in cannabis and CBD. For pets especially, they have more receptors than we do. So that's why we tell patients and we tell owners, we don't want to give them THC. We don't want those psychotropic effects. We just want to get the effects that are going to be relieving anxiety, relieving that pain. And for them, I start them out at a lower dose. We may do 2 to even 3 times a day. And then based on how they're responding within a couple of weeks, I ask the owners to keep a journal for me and rate, on a scale of 1 to 10, with 10 being they're awesome, they're normal behavior, and 0 being not feeling good at all. How are they doing? And it's what is normal for your pet. And then they come back in, and then we talk about how they're feeling. And then I've gotten some really, really good responses, even for the sad stories where in the end, the pet had to be euthanized or they may have passed away just because they were older. I still have had clients come back up to me and tell me, thank you so much for making, his final days comfortable. I really appreciate that.
Oh, that's so nice. That just warms my heart hearing about that.
Me too. I try to tell people whenever I can about it.
Let's see. What is the biggest misconception that your clients have about giving their pets CBD?
I think the first thing you hear when people ask about cannabis is like, are you trying to give a pet high? And you're like, no, I'm not trying to get your pet high. And then they're like, oh, are you going to blow it in their face? Are you going to smoke it? Are we going to share a blunt? And I'm like, no, it's none of those things. So it's really just that education about firstly, what is CBD? Where does it come from? It's not the same as having you and your friend sharing the bong and getting high. No, we're using it for seizures. We're using it for therapy. You should not be seeing those behavioral effects. This is in conjunction. So it's not just a fun drug that you throw up in the air and let's give some to Fido and then I'll take some too. It really is a medicine that can be used to treat and cure a variety of ailments.
Yeah, yeah, I'm gonna just share the bong with my cat.
People are just like, well, I was smoking yesterday. Can I give her some? I'm like, I don't know what you're using. And so we have to look at exactly what it is that you're purchasing. One of the biggest things that I tell the owners, because they may say, oh, I've got some CBD I can use is, what type is it? How many milligrams is it? How is it blended? How are you going to give it? Because you start getting I've got a topical. Well, you can't give that orally. So it's really that education. But they're really receptive, and I think they're really excited about where it can go in the future.
Yeah, like once you take out that part that this plant makes you high, it's a completely different ballgame because you're getting all the benefits from it without the psychoactive high. Mm-hmm. And that seems to be the game changer for everybody. Like my parents are very old school, military family, and they thought, cannabis was the devil's lettuce, and now they're all taking CBD. I have like my entire family hooked on CBD.
Oh, that's wonderful. Well, I'm trying to get like you. My mother came out and I was able to get her to use the CBD topical, and she called me from the airport like, it works my knee. I was right. And then my father, he was in the Army, a Vietnam veteran, and he gets the Army veteran newsletter. And he said on the cover today, he called was cannabis cures and how they're using it for veterans. So at first they were like, cannabis? I don't know, weed. But now you're learning about the benefits that it has.
It just makes me so happy. So I just wanted to ask like a couple fun questions about you just to learn more about you too. So what is your favorite part about being a vet?
For me, my favorite part about being a vet are the stories that I hear from owners and watching the human-animal bond. That was one of the biggest things that switched me over from lab animal back into general practice. I just miss seeing people bonded to their animals and hearing stories about where they found their pet or how they rescued their pet or how their pet found them, and then just seeing that develop. And I mean, some owners and their pets, they look identical, they read each other, and I'm just in the room. I mean, you're here for your shots, but I'm like, tell me, how is he doing today? Did he eat? I mean, they tell me everything. And because I see multiple species, I learned that, bunny rabbits have personalities. People tell me what he ate for Thanksgiving and how they fixed their little bunny at Thanksgiving dinner. And for me, that's what makes coming to work worth it.
That's so cool. You must meet a lot of really interesting people and animals.
Yeah, a lot of really interesting.
And you see all all different types of animals? Like you don't have a limit?
I do not see wild animals. That is where I hold them. And lab animal, I saw predominantly rodents, and I saw non-human primates, so macaques, baboons, mice, guinea pigs, ferrets, pigs, sheep, all types of animals. In general practice, I see dogs, cats, and what people call exotic or pocket pets. So I'll see guinea pigs, mini pigs, birds. I had a really cool chameleon that I saw the other day. Bearded. You never know what's going to come in. And my staff, they're awesome. They're like, "What's today, Dr. Streeter?" So
wow.
pretty much everything. I don't see spiders. Like I have arachnophobia, so.
Yeah, no, thank you. I would be with you on that one. No thanks. Wow, so you know a lot about a lot of different animals then. That's crazy. So we met your cat, and then you said that you had a Rottweiler mix. Is that correct?
Yeah, I have a German Rottweiler. Her name is Shiva Milan Sunrise. And then I have Soleil, who you saw, and I also have a 22-year-old spotted walking horse named Picasso, who I call Mr. Picasso.
Wow, is this a horse that you can ride?
It is. I've had him since I was 11. He was I always wanted a horse, and I had asked for a dog, and my parents said no, so I asked for a horse, and they said yes. I didn't ask questions. I just went with it. I had a horse first, and then I got the other pets when I was in vet school. But horse was my first true love.
Oh, that's so funny. Can't have a dog, but sure, you can have a horse.
Okay.
Oh, and yeah, you can. This is my cat, Minna.
Oh, hello.
Yeah, she's a silver tabby, and then I have he's in the clothes hamper right now, but I also have a ragdoll named Fox. Yeah, he loves to be in the hamper. I'm not sure why.
How old are they?
Minna, she's 5 now, and Fox just turned 1. So yeah, he's our baby.
Do you have a birthday party?
We don't have birthday parties, but I do give them birthday presents.
Okay.
They do get presents. But that was all of my questions that I had. Bevan, did you have anything to add on?
Yeah. How can people find you? And do you have any studies or journals that you're working on based on your experience with pets that you're going to share to the community?
Yes. So recently I started a company called Forest Street, and the focus was on growth. So helping people in terms of cannabis education, growth, and mental wellness, especially as a veterinarian. For me, all of those 3 things have been beneficial in helping me fight depression. And so with that program, I plan on educating people about specifically the benefits of CBD for pets, because there's not a lot of information out there right now. And also, I feel like we should be educating the population about the benefits of medicinal cannabis, because the information that is out currently, we have people who are fighting and trying to bring the correct knowledge to the forefront, but I feel like more can be done.
Awesome.
I agree.
Yeah, so where can people find you? What's your practice name?
Yes. So my practice name is, I'm in Vancouver, Washington. I'm at the Wellhaven Downtown Pet Health. So we're on the first floor. The headquarters on the fourth floor, and I'm the associate veterinarian there. You can find me on Instagram at Dr_Jasmine Shanelle, or on my YouTube channel at Dr Jasmine Shanelle. And then you can also email me at dr.jasmineshanelle@gmail.com. And so those are the places that I encourage people to connect with me.